I remember being a very young kid at home when doctors used to make house calls. And we lived with my grandmother at the time, and she was an Italian immigrant, could speak no English. And I remember her getting sick, and the doctor would actually come by in this black bag, and I always remembered how when he came by, everybody stopped what they were doing and took note and brought the doctor in to talk to her, and when he left, everybody felt relieved, and he felt important to me, and at a young age I could tell that he had made a difference in people's lives at such a young age, and it impressed me. And ever since then, it goes back to second grade. All I've ever wanted to do is be a surgeon. That's all I ever wanted to do, other than being a professional football player at age 7, but that didn't quite work out. But that's all I ever wanted to be, a doctor, and was a surgeon. That's all I ever wanted to be. I think the thing that really attracts me to surgery is the fact that we as surgeons, we affect something rather quickly. We see the outcome quickly. We see people get well quickly. It's very satisfying to see a patient in the emergency room who's really sick, and you help them with an operation, and you see them in the office a week later and they're feeling much better. It's personally gratifying to have been a part of that, and you feel like you're actually physically doing something for them. As a breast surgeon, which is what I currently do, I see breast patients 5 days a week, all day long, and I see new patients that are referred to us in the office have abnormal mammograms and ultrasounds, and we set them up and perform their biopsies, and I will see follow-up patients in the office. I'll have 2 days or 3 days of surgery where we're actually performing breast cancer surgery or other types of biopsies, and we'll follow up with those patients. And several days a week I'll actually sit in my office with patients and their families and discuss their new diagnosis of breast cancer. And it's a very packed week because of the nature of the practice. When women have abnormal mammograms and breast health issues, they're very important and they need to be dealt with quickly for lots of reasons. And so we don't really have idle hours where we're waiting for something to happen because people want to get in and use those spots. So we're always seeing somebody or taking care of somebody, usually most of the day long. When we're referred a patient, what's a little unique about our practice and our breast health practice in Belleville is that we do, as surgeons, we do most of the biopsies for abnormal mammograms and ultrasounds, when in most places it's the radiologists that do those biopsies. But we really look at that as a plus to how we can deliver our breast care, because we get to meet our patients and their families before they've had a diagnosis of breast cancer. We perform their biopsies. We're with them from the very first step. And we're able to create a bond of trust that once they have the diagnosis, they know somebody who can already help them. They're not referred to another doctor to treat them. We can start the process. And I like the idea of meeting a patient with an initial problem and helping them throughout the whole aspect of that, from diagnosis to treatment to follow-up to referral to the other doctors that are involved in their care. And that's what I think is what we really offer our patients in our breast program, is that we can see them through this whole process. We have a plan for every step of the process. My interest happens to be music. I love jazz music. I'm a jazz pianist. I shouldn't say it that way because I play jazz piano. It's kind of like I'm a golfer, but I play golf. Well, I don't play golf, but I play jazz music and I love it. Every Tuesday night I meet with some people in town here. None of them are doctors, and we sit down and we play for 2.5 hours and rehearse. We'll play at paid gigs, we play at charity gigs, we play at nursing homes, and it's interesting because a lot of why I do that is to get away from medicine, but it invariably happens that wherever we play, I'll see a current patient, an old patient, or somebody I'm going to see. And it's a really neat experience to see somebody outside of the realm of medicine in another light, and I see they have a life and I have a life, and it's kind of nice to do that. I distinctly remember just a few weeks ago, we were playing at a local Knights of Columbus Hall on Tuesday night, and I looked over and I saw a woman in the crowd, and I said, I know that woman. And at the break, I went over and talked to her. It was a current breast cancer patient who was going to have her breast cancer surgery the next morning with me. And it was just very unique to see her in that light. So I don't know that you can separate your hobbies necessarily from your work, and particularly with music. There's always been a feeling out there that music and medicine go together, and I think that's really the case. But it was unique to really put it together that night in that way.